Thank you so much. So I am a Romanian living in London, and because my name doesn't give it away easily, so I brought here a very subtle reminder of my origins, which is a bat, and it's not about the Halloween, it's about my country. Okay, I'm also, amongst other things I'm doing, I'm also writing up my PhD thesis with the University of Nottingham, which is on digital health. For those who are still tweeting at this time, you can happily use my Twitter handle. I'm gonna talk today a bit of, another perspective on digital health, eHealth, if you want. And what I'm gonna talk about tonight here, you will see, happening across Europe, across the United States. So it's not only Central and Eastern Europe, but I think it's very good for all of us to be aware of what innovation is happening in other countries in this part of the world. To set up the stage, you've heard a lot already. Healthcare is very fragmented. You have, and the most regulated field of all, through reimbursement, most likely, in most cases. What happened with the digital? The digital came in and opened up a whole new space where innovation can happen. So between all those fragments, grassroots innovation kind of penetrates everything. You hear about democratization because we have new players, we have new connections, we have lots and lots of ideas. We have completely, emerging new paradigms. We have new ideas of treatments, of research, and business models, and even new ideas for assessments of technologies. The digital health continuum, if you want to look at it as a continuum, moves anywhere between patient communities, online communities, to genomics, to research, and even medical education, which is poised for big changes to come. So we have a lot of ideas, we have a lot of diversity, and you've heard already some differences between healthcare systems. When we talk about eHealth, we think often about digitization of healthcare systems, and we know that we have so much variety, not only in Central and Eastern Europe, but across Europe. We talk about different ways of dealing with electronic health records, with dealing with e-prescriptions, but although progress is being made quite slowly in Central and Eastern Europe when it comes to electronic health records and so on, we still see a lot of steps forward. Estonia probably is leading the way in this part of the world. Romania, for instance, just rolled out the electronic health records last November, admittedly with some poor legal framework, not enough, perhaps, security in place, and not enough training. In addition to that, the European healthcare environment is very diverse. Most countries have a combination of public and private providers, as well as insurers, different regulations and reimbursements. But the good news is that innovation thrives with tensions and obstacles and difficulties, and we have plenty of that in Central and Eastern Europe. We see a lot of grassroots innovation coming. We see because of the number of startups, because we see a lot of events and more and more communities. Let's go through some examples of startups, along the ones that you will see in the startup garden. In Moldova, we have Baby Moon, which is an application that focuses on monitoring premature babies from, using skin to skin to using other solutions like real-time vital signs tracking. In Bulgaria, some really cool-looking glasses to regulate your biorhythm. From Poland, Harimata aims to detect medical health conditions really early And, and probably some of you heard about Doc Planner, which is an online booking platform, which just got another round of seed funding of 15 million euros. In Serbia, we have teleskin for dermatology to identify cancerous moles. In Slovenia, Modra Jagoda, for instance, looks to develop apps for medical use. They already have one for drug registry, and they plan another one for rheumatology. And look at this lovely necklace right here. This is a startup in Croatia that develops very good-looking devices for monitoring personal health and well-being. And we have, of course, in Turkey, we have, this is the necklace. And we have in Turkey, as well as in Greece, we have startups. Minamat in Turkey is offering access to online dietitians, and Kare Alia, if I pronounce it correctly, is looking into taking care of dementia patients in care homes or at home. As I said, we have a lot of diversity, and the diversity is reflected also in the environments of these Central Eastern European countries. For instance, the Global Innovation Index 2017 shows this diversity. In most of the countries, as you see, they are ranked between 35 and 64, so right in the middle. So this doesn't show very optimistic, if you want. But moving on, the Global Competitiveness Index 2017-2018, issued by the World Economic Forum, shows even more dramatic differences for the innovation pillar only. You can see again that many of the countries, they rank somewhere in the 60, but you have the outliers like Estonia or Moldova. And yet, there is a lot of funding coming towards these countries, a lot of VC funding, only almost doubled from 2015 to 2016. Romania, for instance, is ranked 42nd in the innovation index that I just mentioned, and 96th as innovation capacity in the Global Competitiveness Report made by World Health Economic Forum. And yet it had the first exit in wearables industry. VectorWatch was taken over by Fitbit. And the winner of Microsoft Imaging Cup in 2016 was also a Romanian startup for ear, nose, and throat. So how do you make sense of that? How come, the region is not evaluated as being very innovative, but on the other hand, you see a very steep increase in the funding for the startups here, and you see quite a few success stories. I'm going to tell you when you look at these reports, one thing that comes across in a very obvious way is that it does pay off in terms of innovation if you invest in your IT infrastructure at the country level, as well as in research and development. And Estonia is a living proof for that. Tallinn was named one of the European hotbeds for innovation in healthcare, along with Berlin and another 3 cities. And it's the only hotbed in this part of the world. And this was done in an article on MedTech Engine, and these are 3 of the startups they gave as example. I'm going to just say something about Hillbed, which offers very interesting, through digital, offers very interesting therapies using music and sounds. And here we are, the Digital Health Society Declaration, also signed in Estonia. And to the points that were made here earlier, related to the fact that digital health did not fulfill a promise, I think on the other hand, it does fulfill promises. We see so much innovation. But I think maybe when we look at this picture here, we should think about the fact that not only all stakeholders in the healthcare ecosystem should come closer, but also we should think of the fact that some of the stakeholders will also be transformed, some of the stakeholders that are not taking change easily coming from outside. So, you know, some of you know what I'm talking about, mainly pharma, healthcare, even policymakers. And getting back to the question, what's there more to innovation? So if it's not, we cannot find answers when we look at these reports, how, you know, the contradiction between the funding and the brilliant startups that we see in this area and the quotation of being very poor for innovation environment. So we have networks of knowledge and networks of people. This is what you don't see in the reports. This is why events like this one here, the one that happened in Poland recently, the one in, you know, the events that HIMSS organizes across Europe and US, these are so important because people actually get to know each other, understand their skills, you know, different perspectives of the world. And I'm going to refer to the event I'm running, which is eHealth, which is part of a bigger event, Fest. And this is another type of events that is very important because they bring together more industries. So you can actually look how synergy, and you can actually see how synergies are created on the spot as they happen, people connecting across, you know, following up. When I actually started with eHealth in 2016, was the first edition, I've been told that probably 20 people in Romania would really understand what I'm talking about. I said, that's not really, it cannot be true. And it wasn't true, of course. So we had a great first year. But more to my point is that this year in the startup competition for the entire festival, so you see like all different streams, the startup winners were two teams in digital health, iSight and CMED 3D. Other important agents for innovation are organizations like eHealth Hub that you have here at eHealth Forum, and we also had in Bucharest this year. They are important not only because they want to bring together the demand and the supply side, and they want to create a network of experts, but because they get to understand different parts, you know, different regions, different countries, different dynamics. So they actually will become pollinating agents, you know, moving, delivering their messages from one country to another. This picture here is not very pretty, but this is going to become an innovation hub only for healthcare. This is going to open in Bucharest very soon. It's going to be called the Health Factory, and it's going to have a co-working space for innovators in digital health. It's going to have a generator, you know, like not really an accelerator, because some of the startups don't need to be accelerated, for startups, and also a plug-and-play area. And this space is going to be open to all innovators in Central and Eastern Europe. We are also going to look into alternative educational programs, as well as in medical education and in entrepreneurship. I'm going to be leading the part with the area of the startups, as well as the partnership. What else is important? This is an example that I had handy in Romania. This is eHealth Romania. It's a portal for news of what's going on in innovation in healthcare. And this is an example of like very steep growth. They sometimes, in some weeks, they reach over 100,000 unique visitors on their platform right now. And this is only in 2 years. What else is important? Facebook, LinkedIn, Twitter, social media, get connected. That's how I met Lila here. So my point is that, really, before I make my points, this is actually a startup in Latvia that is dedicated to medical education and medical professionals. My point is, really, that we arrived at a time when multi-asking is most important. And to what I was saying, that, you know, if stakeholders in this growing ecosystem of innovation in healthcare will come a bit closer and, you know, relax on here and there, I think that we'll see a much faster adoption of these solutions. This means a lot of groundwork that needs to be done, and I'm actually spending a lot of time meeting innovators in Romania, and I plan to do that across Central and Eastern Europe. I'm meeting also stakeholders at different levels, from hospital administrators to policymakers. We actually, this year, we had a senator opening with us the event in eHealth. We have a very diverse community coming. It's the first everyone included event in Central and Eastern Europe. And we are very, very, very keen in fostering dialogue between all stakeholders, from patients to regulators. Local and regional networks are instrumental to generate innovation, to attract talent, to maintain talent, to capture mentors and capital. Maybe some of you are aware that startups in healthcare move from these countries. They move their headquarters to Western countries or to US because they need access to what I just mentioned. And to get those things, to get, you know, good knowledge, good academic attention, good business attention, and investors' attention, we need to connect, and we need to come closer in the region, in our countries and in our region. My message to you today is that the secret ingredient for digital health innovation in Central and Eastern Europe actually is in our reach, and it is collaboration from the ground up. My call to you is, you know, besides really visiting the startup garden and understand those brilliant minds, is to connect and collaborate right here in Greece and in the region. Instead of a conclusion, you know, we all know it. There is a lot of innovation, and I'm really sorry because of the time. I mean, I had plenty of brilliant examples of startups in the region. Thank you very much for having me here today. Actually, this is the first event in Central and Eastern Europe I attend to except Bucharest, and I'm very happy for that. And I'm open to get any questions from you. Thank you.